Dr. Jeff Waldron here to talk about treatment of the neck. Chronic neck pain is a really common issue, especially with so many people sitting in front of monitors, devices throughout the day. You start to get this forward head posture, start to get excessive tone of some of the muscles run along the neck. Sometimes people get numbness and tingling into their arms. So a lot of that can be fixed when people go in and engage the proper neck muscles and retrain these deep neck flexors called longus colli and longus capitis. And there's a couple simple ways that we can go about doing that. If you look at somebody's neck and you see that they have excessive tone where their neck muscles here that run on the side are really popping up, going like this, looks like almost a set of vipers in the front of the neck, then that's usually indicative of them using the wrong muscles in the front of their neck, and they're probably having a bit of pain, and we want to quiet these muscles down. Find these deep neck flexors by simply putting your tongue to the roof of your mouth and doing a little bit of a chin tuck when you go to engage and work on your posture with some gentle chin nods, nice and careful. I'll have patients monitor and tuck in only as far as they can without over-engaging these, so they just stop at the point where they can do it without these popping up. And then once they can control those with the chin nods, then we'll move to some rotations and only rotating as far as you can with your chin in so that these neck muscles don't pop up in that position as well. So you really want to have the tongue to the roof of the mouth and move slowly like so, and then stop when you get to an over rotation and you start to get these engaging. So once people get control over those, which could take 4 to 6 weeks, then you develop holds where you'll go in and hold for 10 seconds and then build up weekly by 10 more seconds in your holds until you're up to 60 seconds. Once you're up to 60 seconds, then you can begin doing lifts of your head without engaging these. And so I'll show you what those look like. We typically do those lying down, although you could practice in sitting or standing, activating some of these muscles. But for now, we'll start with some of the simpler ones, go through a progression, and then you give it a try on trying to help your neck. If you over-engage and do this wrong, you certainly can create increased tension and irritate your neck and some of your neural structures, as a lot of the nerves and blood vessels run through some of these muscles. So if you're over-tightening and doing it very aggressively, which is real common that people want to get in there and get robust with their activation, then you may get more symptoms. So just be very careful. Do less at first until you get used to it, and then add more later. So I'll show you a couple positions lying down and how to work through some of that. If you have too much of a curve here in your back, you can lie a pillow down or a hand towel, support your neck. I'm just going to lie flat for now. So you're lying down here. You go ahead and you can do your chin tucks like so, monitoring. And then you can progress to holds, tongue to the roof of the mouth, and then release, and then go again. And then once you master that, you can do a chin tuck with the rotation. And then once you've mastered those, you can progress to the head lifts. When you lift, you only want to lift maybe a millimeter or so your hair may still be touching the ground as you do the lift. And then you set it down. So 5-10 second holds. Make sure when you do this, you rotate at your ears so your chin is really tucked in, and then just barely lift, engaging. You'll feel your upper stomach engage with this. And then you hold and work. If you do it this way, that is wrong. You're going to start to engage the back of your neck and your upper trapezius muscles, which most people overactivate already because they're sitting in front of a monitor. So go ahead and give those a try. Real common way to help fix strengthening the neck with some of the weak muscles here, especially after whiplash or any kind of chronic injury of the neck. These commonly get weak and shut off in the front and then excessive tone in the back. So give those a try. Thanks for watching.